Good evening, everybody. Well, it gives me immense pleasure to welcome you all to this workshop. Today, we are going to have a Subskills OET Listening Part B workshop. Okay, so in today's session, we are going to cover the format and structure of OET Listening Part B. After that, we are going to learn some tips and strategies. Once we learn the tips and strategies, we are going to put those tips into practice by listening to some actual OET Listening Part B audios and answering some questions. Towards the end of the session, we are going to analyze some of the audio transcripts to identify the key language which are helpful in identifying the answers, and we will also have a glance at the distractors, how they are embedded in the audio to distract us, okay, to confuse us. So get ready with your stationaries, and I want you to discuss in your groups what are all the information that you know about OET Listening Part B. I'll give you 3 minutes for this, and I'll take the input from you after some time once you finish your discussion. Okay, now you can start discussing. So what type of online stuff, like, okay, is it official OET or no, you said, like, okay, you went through an online material, STEP. Okay. Okay. So the audio will be played. What type of questions will be there?
Based on that,
No, variety of questions like short answer questions, gap fill,
only multiple choice.
multiple choice. So will there be gaps? Like, will you get time to read, anticipate, check the answers, something like that? No?
So, for a period of a minute, 1 minute, video will be for 1 minute time.
They will give time. So 1 minute to read the text, and then listen, and then answer.
Like you have told this now before, there will be distractors, right? So same thing with audio, there will be distractions, like sounds.
No, I don't mean sounds as distraction.
Okay.
Here the distraction is different. Like, it's not distraction. Here distractors. So they will say something. They will try to divert your attention so that you won't listen to the answer. So that is distraction. Okay. So can I hear something from you? What have you discussed? What is your idea about OET Listening Part B? So what have we discussed? Like, yeah, I saw you discussing something. So what were you discussing about? Like,
Sir, in the video, there will be audio will be played.
where?
Instead.
Okay, there is an online platform called Step. Like, so you took some tests there.
Yes.
Okay.
In that, there will be a video.
Okay.
We have to hear that, and again below that, we have to answer the questions like multiple choice questions.
Okay. It's in the healthcare setup?
No, sir.
In general. Okay, so that's your idea of listening. Okay, so from there, gamma group, alpha, beta, gamma. Okay, gamma group.
We will hear an audio, like a conversation between the healthcare professionals.
Conversation between healthcare professionals. Great. Like, so what type of question?
There may be anything like the conversation between the nurses to nurses, I mean the nursing colleague,
Good,
or
good,
conversation
good,
between
good.
a doctor and the nurse, and the doctor and other healthcare profession like that.
So how your comprehension is tested there?
So there will be a set of questions like choose the best answers, and there will be 3 options. We should pick any one.
Fine, great, great. Okay, so what is your experience with?
It's the same what you
There
said.
will be a 6 short conversation.
Good.
So followed by 6 short questions. One conversation, one question. In the question there might be choose the best answer, or is
Multiple choice.
only multiple choice.
Only multiple choice. Like, okay, so you're going to listen to 6 workplace extracts. Like, okay, now I want you to take a quiz, a format quiz. So a quiz on the format of OET Listening Part B. It's very simple. I'll display a set of statements. You need to read the statements and say whether the statement is true or false with reference to OET Listening Part B. Okay, I'll give you 3 minutes for this. You don't have to individually work. You can work in a group, because if you want to know something, you can discuss with your friends and you can answer. So each group will be preparing one answer for this. Okay, one answer sheet for this. So please write 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 on a paper. Any one of you can do like. Okay, so you nominate somebody, get ready. You exchange the paper like, so you can exchange your paper with them. Don't worry, okay. If it is partial also, it's okay. No problem. We are exchanging. Okay. Okay. So you just exchange it one more time, like, fine, good. Okay. Now we are going to check the answers. First one false, because it is not 5 extracts, there are going to be 6 extracts. Each extract will have only one question with the 3 multiple choice options, not 4 options. It's not going to be A, B, C, D. It's going to be only A, B, S. Yes? Will there be any connection between one audio and the other audio? No. 6 different audio extracts. Like, okay, the theme will be different. There is no connection between one audio. It's not the continuation of the previous audio. Okay, they are different. The duration of each extract will be less than 1 minute, just 45 seconds. The context sentence will be available in the audio form also. Actually, in the actual test, the context will be read out first, and then you will get some time for reading the question. The audio starts after that. How long do you get to read the questions? 15 seconds. You don't have the luxury of 30 seconds. Just within 15 seconds, you need to read the question and get ready to listen. That is what makes it so challenging. Okay. So this is the common problem with many of our candidates, like other tasks time. So you need to immediately shade the answers. The context sentence can give you only some general, okay, not specific. They're not going to supply you any specific information. The question prompt, yes, they will give you a clue about the type of information that you need to listen to. So how long do you get to mark your answer? To shade? 5 seconds you get. So that's correct. So how many points? Like
8.
they got 8. Okay, alpha got 8.
No, they got.
Ah, okay. Gamma got 8. So you're not okay. They got 4. So where is your? So they got 5. So gamma wins. Sorry, alpha, beta, gamma. Yes, gamma wins. Like, okay, now you're going to take another quiz. Okay, so this is about the overview. I'll take you to another slide. So where the question prompt will appear first, and then there will be 3 options. I'll be displaying them one after the other. Then you need to decide which one is the option. So you get 30 seconds after the 3rd option appears. Okay, you need to decide. Yeah, I'm trying to select. This is the prompt. In OET Listening Part 2, Part B, you will hear option 2. Great. So, under OET Listening Part B, you will hear a series of 6 unrelated monologues or dialogues. Okay, it can be a single speaker or it can be 2 speakers. Like, okay, so the length we have already seen is going to be around 40 to 45 seconds. Okay, what about the distractors? Like, okay, so 2 clinical consultations, listening part A. Presentation extract running about 5 minutes, like, okay, that is part C. Okay, so part B is 6 unrelated monologues or dialogues. Okay. Now, okay, you need to answer the questions. Like, for example, have you got any idea about what are the language skills? What are the 4 language skills? Yes, LSRW. Okay, listening, reading, speaking. Have you got any idea about what are subskills? Language subskills? What are subskills? Understanding the question? So subskills are nothing but certain specific behaviors or strategies applied by the language users in order to be proficient in that particular language skill. Okay? For example, prediction, anticipation is one of the listening subskills. That is the key. Without anticipation, without prediction, getting good band in listening is very, very difficult. So that is one of the soft skills. For example, you're called for a meeting. The agenda is not given to you, but based upon the situation, you know why the manager is calling you, why the supervisor is calling you. So you anticipate something, that is one of the sub-skills. So what is the advantage of it? This sub-skill is going to help you in perform better in your particular listening. So that will increase your productivity in the work site. Okay. Now, in your group, please discuss. I gave one example, prediction. So what are the other listening sub-skills? Please discuss in your group. So sub-skills are nothing but something that helps you to perform well in that particular language skill. So what type of skills will help you to perform better in listening? Yeah, I said prediction, anticipation, that is one thing. Other than that, you will listen to the keywords. Yeah, try. Prepare the list, like specific information can be just listening. Good. Okay. Here is the list. These are the listening sub skills which will help you to do better in listening in the exam as well as in your work site. Okay. Now try to define each of these listening sub skills, or discuss in your group and try to find an example from your workplace experience. So think of a scenario in your workplace where you will employ just listening for gist. I'm not going to listen to each and every point he says. I'll just try to get the overall picture. That's all. I won't pay serious attention to this. My intention is to get the overall picture, something like this. So find a scenario for each and everything, or at least, okay, I'll give you 2 minutes for this. Try to find as many scenarios as possible. I'll just, yes. So, thank you. So, can I get from this group, okay, give me one example from your workplace. So, which skill you normally use in your workplace? Give me one example. Yeah, Ramya, you discuss something, come on. Yes, please, yeah.
Listening for teacher, collecting information, history from the patient.
Okay, so when the patient is describing his symptoms, okay, you will be collecting, you will be listening in detail. Okay, that's good. Yes, from this group, listening for gist.
Specific information. Only what they have, only thing we are expecting
You will be looking for something like,
Yes.
you will be looking. When the other person is
When
talking,
patient is coming for diabetic medicine, only we are looking for their blood
Yes,
sugar
what's the
level,
sugars?
not other.
The passing.
when he is giving some other symptoms, you won't listen. Oh, man.
So that's
Yeah.
more
They're
important.
telling
right?
own stories like anything.
No,
Mm.
when the patient is getting admitted at the night, and the next day the doctor is wanting some information, the most common information which he wants is if the patient is admitted for some diabetes or something, the next day he wants only the particular information, like how far the sugar.
So you will be looking for specific information. What is his blood glucose level? Okay. Yes, please. Yeah. Yeah. Louder, please. Yeah.
We have tried for two, but two months.
Yeah. Okay, no problem. Like, okay, give me one example from your workplace. Like, yeah.
For example, in a critical care unit, we have doctors will discuss about the patient with other doctors. Like if a nephrology will tell about patients what he can suggest the other treatment, how it works with other, like example with the nephrology will consult with the cardiologist.
Okay.
What they are speaking is
So when the nephrologist is talking to a cardiologist, what the nephrologist will be listening for?
we listen. We have to know the information, how it's work.
Yeah, specific
What's the
information.
reason they have suggested this
Okay.
treatment. We should know
Okay,
that.
okay, great. Okay, now let's do one thing. Let us change the roles. Now I'm going to give you some scenario where you are going to identify, yeah, in this scenario, these are the subskills which are going to be used. Okay? Now,
Can we take a shot of this one?
yes, please. So take a screenshot of this, or yeah, note down. Yeah, it will take time. Okay, take a screenshot. These are the listening subskills.
Yeah, the next activity.
Okay, now, yeah, now we are matching the subskills to the scenarios. This is the first scenario. Yeah, the list is in your hand. So what subskills will you use in this situation? Yeah, just think like only detail. Okay. Sometimes specific information also, like, okay. So when handovers take place, gist is not going to work. Like, okay, so you will be listening in detail and you will pay some specific, okay, pay attention to some specific details like, okay, what are the medications to be administered at what time. So all those things. So then from the list, any other thing? One more thing is possible, like, so a patient is handed over to you. Handover, no, like, okay, handed over to you. What is the future course of action? So we'll be listening for that. What am I supposed to do? How am I going to take care of the patient until the next nurse comes and takes over? So future course of action. How am I going to take care? So you will be listening for detail. Okay, you will be listening in detail, listening for specific information, and then listening for, okay, next scenario. Specific information, any changes implemented, okay, any new rules, okay. New staff, this is to be underlined, okay, new staff. So you will be looking for some specific information. So what type of thing? So what is the procedure here? Where should I sign in? Will there be any biometric? Or by the time you report, you are feeling very hungry, so you want to know where is the cafeteria. So when the staff is briefing about the layout of the building, then you will be curious about where is the cafeteria, where is the coffee shop, like, okay, something like, so specific information. Yeah, orientation. Then any other thing? Okay. Opinion. Okay. So your trainer says, or your supervisor says, okay, I observed your okay, work performance, like, what I'd like to tell you is, in my point of view, time management is one area where you need to improve or focus more attention on. So that is his opinion. So he's expressing his opinion that, okay, this is one area. And when he's giving feedback, you'll be listening, okay, what is his purpose? he says, follow the safety regulations. If not, you are going to face the consequences. For example, he says, okay, so what is the purpose? He is warning you. So he is warning you, if you are not following the safety precautions, then you are going to be in trouble. So that is his opinion, okay. And what is the purpose? His purpose is to reiterate something. He wants you to follow the safety guidelines strictly. Then what else? You will face the consequences. Maybe he's talking about the future course of action. So if you are not meeting your deadlines, you will face the consequences. So he is just, okay, predicting maybe, like, okay, so you are going to be in trouble. Okay, now, so you know what are subskills now. So you are going to use these subskills when you attempt the questions in. Okay, now I'm sorry. I don't know where is my mouse. So imagine you are taking the OET test. Listening started. You finished part A. You turn over the leaf and you see OET Listening Part B in front of you. So what type of question you will come across on the paper? What can you see on the paper? MCQs. Three multiple choice question. Okay, so you'll be listening to an extract and you're going to answer 1 3 multiple choice question per extract. Okay, then you won't get the second opportunity to listen to that. You need to note that, like, okay, you only get one opportunity to listen to the audio script, so you need to focus all your attention. Once you skip it, then you won't get it back. So you need to focus all your attention because the tape is going to be played only once. Okay, now this is what you will see on the test day. Okay, so what is this? Multiple choice question. So I have put some numbers. Now we are going to name them. Name this part. The easiest first. Shall we go from the bottom? Okay, I'll give you the answer clues. Once you give the number, first one is question. This is question. Context. Okay, so number 1 is the context. So it gives you the scenario. Okay. Number 2, question prompt. Okay. So question prompt tells you, okay, so what type of information that you need to look for. So these are, okay, so on the test day, on your paper, you will come across multiple choice questions. Any multiple choice question will have 3 parts. One is the context sentence, the other one is the question prompt, and the third part are, okay, these are the answer options. Okay. Now, how many types of MCQs are there? Have you got any idea? How many types? Will there be any variation in multiple choice questions? Okay, now I am going to display 2 multiple choice questions. Okay, maybe you're right, like, okay, we'll see. Like, you're supposed to spot the difference. Shall we have a competition? Like, so the moment you spot the competition, say bingo. Let me see which group identifies it first. Read this one. This is one type.
Show the other. Spot the difference.
No bingos yet?
Second one is fill in the blank.
Fill in the blanks.
Like open.
Open-ended question. Which is open-ended question?
Like a sentence.
Okay, so one is an open-ended question, and the other one? No, it's not closed-ended. Closed-ended means like, okay, yes or no. Yeah. Sentence completion. Okay, good. So this is the difference. So these are the two possible MCQs. So there are only two types. So the multiple choice questions can be WH question, open-ended question, where you need to find the answer from the options like. So the other one is you will be completing the sentence by choosing one of the options. So one is open-ended question and the other one is sentence completion task. Okay? Now we are going to take another quiz. Okay. Now any listening activity is actually divided into three parts. Pre-listening, that is certain activities that you need to do, certain things you need to do before the audio begins to play. While listening activities, when the audio is being played, when you listen, what should you do? And post-listening activities, once the audio ends, what should you do? So now let's start with pre-listening activities. Pre-listening, okay, any idea? So what will you do before the audio begins? Please discuss in your group. Yes? Yeah, this group. Read the questions.
Which is predicting what is topic for later recording like this.
So read the question means what will you read? Like everything. Read everything in the question paper and then you will think what information will come in the audio. Yes, sir.
First we will read the question,
Okay.
not the answer options.
Not the answer options, like
We will read the question and we will mark the key points in the question.
one in the question or in the context sentence also.
The context, no need to read the context sentence because anyway they are going to repeat in the
They're
audio.
going to play. Okay.
So we can use time by reading the question and we can underline the key points and we can look for the specific point in audio while they are.
He has a point. There is no need for you to read the context sentence because you will begin to read only when they say like, okay, the audio starts with the context sentence. After reading out the context sentence only, your reading time starts. So you listen to the context and then you read the question prompt. So no need to read the answer options.
No need to read the
Okay, please.
Only we'll read question prompt on this.
Only the question prompt. So why shouldn't you read the answer options? Yes? No. He says like, okay, no need to read the answer options. So no, why? 15 seconds. The question prompt will be very, very small. Like, okay, so that is altogether a different discussion. Like, okay, whether you have time or not. But he says like, okay, no need to read the answer options. So in what way reading the answer options will be counterproductive?
Maybe it will confuse.
Distract, they will distract you. Good. Okay, so in what way they will distract you? All the three options will be suiting. Okay, so fine. When you read the answer options, when the audio is being played, you will try to match the information there. So you will be, okay, you know all the answer options. You will be looking for this information there, or you will try to match the keywords from the answer options to come on the video. Like, okay, so this type of distractions might be there. So it's better not to read. Like, okay, that's fine. Now, I have 3 questions for you. Question number 1, how many seconds do you get to read the question? 15 seconds. Like, okay, so how many speakers are going to be there? 1 or 2? Okay, so not more than. So will there be any group discussion, like where multiple speakers are possible? Will there be any group discussion? Audio? No. So it's going to be either dialogue or monologue. Okay, so now how can you make use of the context sentence? Context sentence. You will be listening, you know, like, so how can you use the context sentence? So what type of information you will infer from the context sentence? Tell me. Who is the speaker? Okay, who are the speakers? Like, then
Who are the listener?
you are the listener.
Who
The
is
topic. Yes, the topic. Good. Then
You just have a vague idea regarding they're going to speak this thing.
the context. That is the context. Like, so you will have an idea about who are the speakers, how many speakers are going to be there. You will get an idea even before the audio begins. You know whether it is going to be a monologue or a dialogue. Okay, so how many speakers are going to be there? Then through the keywords you will get an idea about what is the content of the discussion, what is going to be the content of the discussion. So what are they going to discuss about? So this way, okay, so what will you guess from the question prompt? From the question prompt. Okay, what type of information that you need to get from the audio. Like, okay, now, so these are the answers. Like, okay, you get 15 seconds to read the question before the audio begins. So wisely use these 15 seconds. Now here there's going to be a list. Okay, well, I'm going to display another slide where you come across a context sentence and a question statement, not the options. Like, so based on that, you need to find out all this information. So whether the, yes, take a snapshot of this so that you will be finding answers to these questions. Like, what type of information the question is focused on. So this is from the context and this is from the question prompt. So please, now you can take the shot. Like, okay, this is not included in your previous one. Okay, now once I display, first you highlight, I mean you cannot highlight, you just note down the keywords. Okay, from the context just highlight only the keywords, note down the keywords. So what are keywords that will help you to get some idea? Now, matching. So from this, the keywords are surgeon, surgical complications, patient. Now from the question prompt, this is important because, okay, just highlight the keywords
In the question prompt.
from the question prompt.
Let them do it first. Let them do it first. And now down the keywords.
Then emphasize risk factors, emphasize. So from the question prompt, explaining risk factors, emphasize. Okay. Now, in your group, please discuss what are all the language the surgeons use when they are forewarning the patients about the surgical complications. Whenever the surgeon is talking about the complications to the patients, what common language they use? Some sample vocabulary. Yeah, please discuss. Possible complications. Okay. Yes. Can I get some input from there? So usually,
Yeah, usually surgeon may be using these words. Look for, watch for.
okay.
You,
Please note that.
If you notice.
Okay.
These are the words.
Yeah. If you come across, if you experience any inconveniences, please let me know. Like, okay. So now you come to this one. Like, okay. So what words they will use to emphasize? What is the meaning of emphasizing something? Stressing something. Yes. Other words, paraphrase this word emphasize, because you are not going to listen to the word emphasize there in the audio. So convince, he will try to convince you. One.
Please watch for.
Watch for. Okay. Alert. Okay. So emphasize means he will be reiterating. He will be telling it more than one time. So be careful. Okay. He will be stressing it. Stress. When you want to stress means you will be repeatedly telling that, like, so because you want to let the patient know that these are the complications that might occur. So if any of these complications occur in you, the surgeon might not know this. So you need to tell the surgeon, if you experience these symptoms, please let me know. So he will be telling it very clearly, repeatedly. He will forewarn the patient. Okay. So emphasize. Now, let us see different steps that we need to follow while listening. So I have prepared a quiz. Again, it is multiple choice question. Only 2 questions with 3 choices. Okay, 3 multiple choice options, 2 questions. Just 1 minute answer. Strategy quiz. Okay.
Because
Yes, sir.
choose A, B, or C, which one? First one?
Yes. The first one? First one is B. The second one? A. Okay. So what will you be doing when the audio is being played? So once the audio begins, what will you be doing? You will be doing multiple things. Multitasking is the key. Listening. Going through the question options to choose the answer. Okay. So at the same time, what should also be there? The question should, the type of information, the question prompt, the type of information that you are looking for. So that you will get from the question prompt. So the question prompt should echo at the back of your mind. So you should remember the question. You should be listening to the audio, and then you will be going through the options to choose which option is the correct option. So option B here. So here, what should echo at the back of your mind when you are listening? So yeah, we will just go through this one. Sorry. Yes. Convert it into a very short phrase. What is the patient concerned about? Patient's concern. Patient's concern. What's the patient's concern? So similarly here, they agreed to choose the method which will. So which one they agreed? Something like this. Convert it into a very short phrase so that you can remember it. So if you keep the question paper in front of you, like, and then if you read at the time they agreed to choose the method which will, then you will be confused. Like, so you read it, convert it into a short phrase, always remember it. When the audio is being played, you need to, what's the patient's concern? What is he concerned about? What's he concerned about? Like, and then here, okay, what did they agree? So what they agreed upon? What they agreed? Something like this. So this should echo at the back of your mind, so that will make your job easy. Okay, now, sorry,
escape menu.
yes sir.
Oh, yeah, shut them on. Let them come, Let them come.
Yes, sir. So listen to the whole recording before you answer. Why is it so? For example, the audio begins. In the third sentence, you already found the answer. You think, yeah, this is the answer, because it is something to do with your domain knowledge. So you also use your domain knowledge and you chose the answer. Can you stop listening? You can share it and move on to the next question. No. So what will happen? What will happen?
At the end, the answer may change.
At the end, answer may change. But okay, in your case, like, okay, answer might not change because, okay, you are using your domain knowledge, like, but the speaker may give you more appropriate answer. The first one is also correct, okay, but towards the end, the speaker may give you more appropriate answer. Multiple choice is all about choosing the best answer. It doesn't mean that option A and C are wrong. They are also right, but B is more appropriate. So listen until the end. So you decide your answer. It's good that if you get the answer in advance, but make sure the speaker is not giving a better answer. Okay? So listen up to the end. Then at the end of the recording, you will have 5 seconds to shade your answer, not choose your answer. Don't put a tick mark. So this is what? An unpardonable error. It's not just an error, like, because you are making your intelligent effort to find the correct answer. After having found the correct answer, if you are losing the mark, then it is really unpardonable. Okay, so be careful about it. Shade the answers then and there. Okay, now shall we get some practice? Yes, we have learned the tips and strategies. Now we are going to apply those tips and strategies when we listen. Okay.
So we will play the tape now?
Yeah.
Change the battery? Yeah, you want it? Okay. Can we stop?
If it is okay, so feeble, please tell me so that I can increase the volume. I think we tested it, it's all fine.
All right, come on.
Okay, fine.
Right, start.
So now we'll get it this way. Once I display the question, on right there will be some timing part. The countdown timer will start 15 seconds. After 15 seconds, the audio will start, and then once the audio gets over, there will be another countdown here. 1, okay, 5, 4, 3, 2, 1. So that is the time for you to shade the answer.
They can't shade.
Yeah, they can't. You need to choose. Like you will be writing the answers. Like okay, fine.
Move out from the beginning. Right, start the audio. Play the audio. Use the mouse.
With any surgical procedure, there are possible complications which you need to consider.
I see.
Tonsillectomy is common, but can pose considerable risks, especially in adults such as yourself. So, monitoring for and reporting any signs, especially in the first few hours, is crucial. You'll be having a general anesthetic, and although reactions are quite rare, it does have potential dangers. During the operation, there's the chance of excessive bleeding requiring further treatment or intervention. After the operation, swelling of the tongue and soft palate can occur, leading to difficulty in breathing, and, of course, bleeding may occur during this time also. This is also when infections can occur. Now, I must stress again that although such complications are rare, if you do experience any discomfort or if anything's worrying you, you must contact me immediately.
Okay.
Right, time's up. Make a decision. Time's up. Talk to your partners. What can you do?
Fine. C, A, B. Yeah, if you have any difference of opinion, for example, you say A and your friend says C, okay, let her A. Now they become a minority now. Like, good. Okay. Now I'm going to display the audio transcript. Okay. What you have listened, you're going to read now. Like, so find out. So now the keywords from the question. So the keywords are, we have already seen this one. So surgeon giving surgical complications, explaining, emphasize. So what are the words that emphasize?
Let them read.
Okay. Is crucial. Here I stress. Now I must stress again. So he's reiterating. He's telling it again. Now you go through these things like. Now let us see what is the answer. So usually the pattern is in OET, out of 3 options, the correct information will be there in the audio. The distractor will be mentioned contradictorily, and one they will just leave out. So one of the options they don't mention in the text. But this also you can infer. We have been thinking that okay, this is a simple operation. Tonsillitis is a simple operation, but it is not so. Okay, we can infer, but that is not what he's emphasizing. He's just mentioning it, but he's not emphasizing. So here, need to investigate any symptoms. So he is telling it here, and he is telling it here, and the type of words. What are the keywords? Here the keyword is it's crucial. So what is happening during the first few hours? First hour or first few hours? Especially the first few hours. What are the symptoms that you experience during the first few hours is crucial. So he is emphasizing this. So beware of this. Then again he stress. Okay, I must stress again that although such complications are rare, so if you come across anything, please let me know. So now you got it. Shall we go to the actual test? Now I'm not going to stop. Okay, you won't get the luxury of reading this audio transcript and all. So 3 questions will appear one after the other.
Can you read the transcript and can you analyze whether the other 2 options are there or not?
Yeah.
Can you
Find out.
of the other 2 options?
Because you chose, you chose C,
Let them do that.
Yeah.
Let them do that. Additional surgery may well be required. Any evidence there? Look properly.
Yes, there's a chance of excessive bleeding requiring further treatment.
Further treatment and intervention. Intervention can be surgical intervention.
Okay, so fine, that's there. Next, look at the third one.
Severity of all considers
Correct, it's common and thing, yes. So it's there, right? Then how come A is the best answer?
Yeah.
Because the question says emphasis. What does it say?
Emphasis.
So he's explaining, but the emphasis is on A. Yes or no?
Yes.
So all of them may be mentioned, but the question is key. That's what I learned, isn't it?
Yes.
So there's one word in the question.
Identifying the
What does he
keywords in the
emphasize? What is
question.
he concentrating on? Okay, so that's important.
Another important tip is once you decide that this is the answer, please read it along with the question. So once you decide this, okay, just read it along with the question one time. If it is a sentence completion question, it will make sense okay. So the surgeon is explaining risk factors to the patient to emphasize the need to investigate any symptoms. You read it and then you think what the audio said, you will be able to eliminate the distractors, you will be able to find the answer. So whenever you choose the answer, if it is sentence completion, read it. Even if it is, open-ended question, you go through the question one more time and make sure this answer makes sense that way. Okay, now let's start. There are going to be 3 questions which will appear one after the other. I will never interfere.
Yes, okay, ready. And this is a test, okay, so be careful. Read the question carefully.
Well, you've got what's known as a bunion.
It's just so ugly. I've even stopped wearing open-toed shoes. How did this happen? I mean, I'm far too young to have this.
That's actually a common misconception. The condition can be inherited or even associated with diseases of the joints like osteoarthritis. But the most common cause is poorly fitting footwear, particularly shoes with narrow toe boxes.
Most of mine do have rather narrow ends. But surely that can't change the shape of your foot. I mean, my big toe's pointing in the wrong direction.
What actually happens is the metatarsal, which is the long bone in the middle of your foot, deviates towards the other foot, while the hallux, otherwise known as the big toe, pushes towards the other toes, so we get a very prominent joint protruding outwards, such as you have here.
I see.
But make sure you've chosen the answer A, B, or C, okay? The next one, ready? The next one is on it's a test.
Now, Mrs. Daniels, I'll need you to keep your arm as still as possible for me. I know you're in quite a bit of pain, so I'll try to be as quick as possible.
I'm sorry, I can't keep it still because I'm shaking. I'm nervous. I may have broken an arm. I've never broken anything before, never had surgery. And the thought of lying on an operating table just frightens the life out of me.
I understand you're nervous, Mrs. Daniels. It's perfectly normal. Just try to take some nice deep breaths, and then when you feel you're ready, we'll start.
But it's hurting me. I had no idea X-rays hurt.
It's not the X-ray itself, it's the positioning of your arm. I'm sorry, but it's necessary to take them at various angles so the doctors can see even the smallest of hairline fractures.
Okay, I'll try.
After cardiac surgery, it's important that we get the patient moving. They don't always want to, usually because of fear. They've just had a sternotomy, so they're frightened it might burst open.
I would be too.
We have to encourage deep breathing from the outset. For this, we use an incentive spirometer, a very important apparatus to help prevent pneumonia, amongst other things. The next step is to start ankle pumps and circles to help prevent the pooling of blood in the lower extremities.
Okay, they sound simple enough.
Not so simple for them. So it's important you explain why they're doing the exercises. The next step is standing and sitting. They'll clutch their chest with a pillow to stop from using their arms. It's vital for flexibility and muscle tone. Finally, we get them ambulating. How far they walk determines when they can go home. That's always a good incentive.
Yeah, drop your pencils. So, what's your impression like? Okay, or challenging or moderate? Challenging. So what is really challenging? Like, okay, the reading time is not sufficient, or the audio is too fast, or too much of information? Too much of information, or different domain? Yeah. Anyway, that's it. Like, so now we are going to go through the what transcript, audio transcript. Like, okay. The keywords now. Why didn't you just go there? Like, okay, you're finding it difficult here, so please move, or you can sit in this chair. Like, okay, she will sit here. Like, okay, okay. The keyword surprising. So when she listens to this, the common cause is poorly fitting footwear. So there are multiple reasons. It can be hereditary, or it can be due to some other thing, like, but one prominent reason is poorly fitting footwear. When she listens to this, okay, particularly shoes with narrow toe boxes. Poorly fitting footwear, particularly shoes with narrow toe boxes. When she listens to this, she says, like, most of mine do have rather narrow ends. Yes, I realize, okay, most of my shoes are, okay, pointed tip, like, okay, but surely that can't change the shape of your foot. Like, again, she's not ready to accept, like, okay. So she says, she's showing some surprise and she's not ready to accept. Like, do you think the shoes will change the shape of the toes? That can't change the shape of your foot. I mean, my big toes pointing the wrong direction. Then he's explaining the medical condition, like, so how it happens. So here she shows her surprise, like, but that cannot change. Yes, pointed tip, but that can't change. So what was your? Okay, so anybody chose any other option? See if you can justify. If you have chosen any other, see if you can. Shall we move to next question? Yeah. So here, radiographer, patient, X-ray procedure, anxious. Here the key word is why was she anxious? So why she anxious? Why she anxious? Right? Okay. I'm shaking. I'm nervous. The thought of lying on an operating table just frightens the life out of me. I never had any surgery. So the very thought of lying on the operation theater table just frightens my life out. Okay, frightens the life out of me. May have fractured a bone, she mentions, but that she's not anxious because of that. Like, she's feeling the pain because of that. So fine, it's in great deal of pain. She's anxious because when you're painful, your focus will be there on the pain. Like, okay, you won't feel anxious. Like the third one. The keywords. What is the stressing? Again, emphasizing. It's important. We have to encourage. It's important. Always good incentive. You tell them, like, okay, you have to walk, you have to do this exercise, only then you will get discharged. So the very idea of, okay, encouraging them, like, okay, if you don't do this, then you are not going to get discharged. You will stay in the hospital. So that's one, always a good incentive. Okay. The need to motivate patients. Like, so how many of your answers are, anybody who got 3 out of 3? So this group, like, okay, so you can take OET. Don't go for IELTS. Okay. So fine. So what is your takeaway from today's session? So listening part B, yeah, I know, like, okay, none of the English language proficiency tests will be that easy. So it's challenging, but with adequate practice, with proper tips and strategies, you will be able to crack it. One thing. So the key here is make use of the 15 seconds reading time and then apply the strategy. The thing is, underline the keywords, okay, read the question prompt properly to anticipate the correct type of information, and then convince your brain, like, okay, it's not going to be long. Okay, 45 seconds, focus, because it's multitasking. You need to keep the question in mind, you need to listen, you need to eliminate the, okay, wrong options, all those things. So convince your brain, stay focused. Wish you all the best. Thanks for attending. So over to Sir. Like.
Right. So now, thank you everybody. A big round of applause for everybody here. And Vinod sir, great job done.
Thank you, sir.
But all of us, we must also thank E2 Language, especially Jay. He's been very kind to choose InSync to launch this. And I think you must be, by now, some of you have already felt the level that is required to get through the OET. because most of you all were finding these scripts and these listening audios a little bit challenging. So my only request is, don't blindly go and try and take the test without really coming up to the proficiency level in English that's really required to help you get past the OET. All right, so all of us, we must tell Jay thank you, so we can look there and say, thanks a lot, Jay. It was wonderful, thanks a lot.
Thanks a lot, Jay.
Yeah, all the best, okay? So please give your, we've got your numbers, so you'll receive a short survey on the materials, on certain questions that E2 has prepared. You need to fill that in and immediately send it. Not to us, it will go directly to them. So it will be a link we'll send you. Okay? Thank you so much. All the best. Yeah. Thanks.
Thank you.
Good job, Vinod.
Sir, thank you, sir.